Hey Kitty, get ready quickly. It's an emergency. We need to visit China.
China?
Yes, little kitty. People there are suffering from a new deadly outbreak caused by coronavirus. And I have been called there to research it. Hey friends, I'm sure since the past few weeks you have heard a lot about this new disease called coronavirus. So in today's episode, let us try to explore what exactly this virus is. What are the causes, symptoms, and measures we need to take to stay safe from this illness called coronavirus? Zoom in! Hey friends, by now, most of us are aware of the outbreak of the disease started in Wuhan, China, caused by a new species of virus called novel coronavirus. They belong to a member of the coronavirus family that was first identified in the 1960s. They are responsible for causing a range of diseases in humans, including the common cold and more severe and life-threatening forms like SARS and MERS. But the crucial question is, how did the recent outbreak occur? Well, like other coronaviruses, it has come from animals too and is a form of zoonotic disease. Many of those infected patients either worked or frequently shopped in the Huanan seafood wholesale market in the center of the Chinese city, which sells meat and live animals. It is believed that the virus might have been transmitted through direct contact between humans and animals, either by touching those animals or consuming them. And it can also spread via the air like other cold-causing viruses. However, unfortunately, the actual source of this disease isn't confirmed yet, and scientists are still trying to figure it out. But what we know so far is its symptoms and how it affects humans. Yes, a person infected from this disease may suffer from dry cough, mild fever, and breathing issues, which may go unnoticed at first. But as the virus spreads its legs inside the person's body, the patient might develop a severe case of viral pneumonia, an infection that inflames the air sacs in the lungs and can cause them to fill with fluid or pus and needs immediate medical attention. Also, it is believed that these viruses are more likely to infect older people and those with a weak immune system that find it hard to fight these notorious viruses. But is there any way to treat this disease? Well, unfortunately, all this is a very new illness. No treatment for it is available so far. And because it is a virus, antibiotics won't work against it. Now, here comes the most crucial question. What can we do to stop this outbreak? Well, it is always advisable to practice good hygiene and caution by avoiding close contact with individuals suffering from acute respiratory infections or wild animals or livestock, dead or alive. Also, it would be best if you wash your hands with warm and soapy water regularly, especially after being in direct contact with an infected person. And if you find any of the mentioned symptoms, do visit your doctor ASAP. Trivia time! Did you know the virus is named after its shape, which takes the form of a crown with protrusions around it, and hence is known as coronavirus? Also, The full name of the current form of coronavirus under outbreak is the 2019 novel coronavirus or 2019 nCoV. Hope you enjoyed today's episode. Until next time, it's me, Dr. Binocs, zooming out. Never mind. Hey friends, as we know, the majority of confirmed cases of coronavirus disease, aka Covid-19, has been reported from mainland China. The notorious virus has managed to spread its leg to many other countries and regions around the globe. While the scientific community is trying their level best to find a cure for this disease, its expansion can be easily prevented by following specific safety measures by us. So, in today's episode, let us have a look at the steps we need to take to defeat coronavirus and protect ourselves, our loved ones, and the world. Zoom in! We have already learned about this coronavirus outbreak in our previous video. If you haven't seen it yet, I will request you to kindly have a look at it by clicking on the link given in the Show More section below. Most people infected by COVID-19 experience mild fever and manage to recover in some time. But it can be more severe for others. And the main concern with this virus is that it is constantly looking for a new host to execute its evil plan. But worry not, my friends. With a few simple steps, we can easily defeat this disease and spoil its wicked intentions by doing the following. First, although it may sound harsh, please try to avoid any close contact with people who are sick, especially those suffering from fever, cough, cold, or acute respiratory infection. And if you are the one suffering from any of the mentioned sicknesses, make sure to visit your doctor ASAP and share the information about your recent travels, if any. And after that, take your medicines on time and do stay at home until you are completely cured. And in case anyone has been confirmed to be infected by this virus, please make sure to wear a face mask and prevent the spread of this disease to others. The next step you should undertake is while coughing and sneezing, cover your mouth and nose with a flexed elbow like this, or best, it is always advisable to use a tissue. But make sure to discard the used tissue into a closed dustbin so that any virus has no room to escape into the open environment. The next very important thing you must do is wash your hands often with warm and soapy water for at least 30 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing or sneezing. And avoid touching your eyes, nose and mouth after that. If soap and water are not readily available, use an alcohol-based hand sanitizer that is easily available in the market. And lastly, help your parents to clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. And if you are still confused about where to start, the easiest thing you can do is by sharing this video with your friends, family and teachers so that together we can fight this terrible disease and bring things back to normal like before. Trivia time! Did you know viruses and the diseases they cause often have different names? Yes, people usually know the name of a disease, but not the name of the virus that causes it. The official name for coronavirus disease is Covid-19, and for the virus is Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV. Also, the good news is someone who has been completely quarantined or has been released from isolation does not pose a risk of infection to other people. Remember, my friends, humanity has been through a lot of epidemics since its inception, such as plagues, swine flu, bird flu, etc. But in the end, we have always come together and risen up as the stronger force and managed to beat these diseases. So, even now, all we need to do is help each other by spreading awareness about these small steps. Stay calm, do not worry, and as history has shown it, this too shall pass. Hope you learned a lot from today's episode. Until next time, it's me, Dr. Binocs, zooming out.
Hey friends, in recent times, we have seen an unfortunate rise in the cases of COVID-19 and 21. But most of us are not aware of how this tiny virus can cause such a big mess inside our bodies. So, in today's episode, let us see the journey of a coronavirus and explore its evil plan to conquer its victim. Zoom in! Like any microbes out there, the coronavirus's primary goal is to expand its species through reproduction. So, let us see how the virus achieves this, starting from peeking inside the virus where we can find the genetic materials needed for making multiple copies of itself. This genetic material is covered by a protein shell to protect it while traveling inside people's bodies. And this shell is coated with an outer layer that allows the virus to infect healthy cells by merging with its outer membrane. And finally, we can see the spikes of protein molecules pointing out from the outer layer. The coronavirus uses these protein spikes like a key to get inside the healthy cell in your body. There it takes over the cell's internal mechanism and restructuring it to develop the elements to form new viruses. Let us see how. Yes, once an infected person coughs or sneezes, the liquid droplets carrying the virus may end up on someone's mouth, eyes, or nose, which allows the virus to enter inside their body. Once inside the body of the new host, the virus attaches itself to the healthy cell lining of the nose, throat, airways, or lungs. Then they start executing their master plan by inserting their spike into the receptor molecule of the host cell membrane, just like a key in a lock. This process permits the virus to get inside the healthy cell. In the case of a common flu virus, it would travel inside a sac made from your cell membrane to your cell's nucleus that stores all its genetic elements. But when it comes to the coronavirus, it doesn't need to invade the host cell's nucleus. It can directly access the parts of the host cell known as ribosomes, which utilize the genetic information from the virus to produce viral proteins, such as the spikes on the outer layer of the virus. After this, a packaging structure in your cell carries the spikes in vesicles, a structure within or outside a cell consisting of cytoplasm liquid. This process allows the spikes to merge with the cell's outer layer, and all the elements required to give birth to a new virus gather just beneath the cell's membrane as a new virus pops out of it. And this process is repeated again and again as the virus multiplies and spreads in the victim's body, leading to severe pneumonia. How? For that, let us first enter into your lungs. As we can see, each lung has separate sections, which we call lobes. When we breathe, the air moves freely through your windpipe, then travel through the large tubes called bronchi, and then moves through the smaller tubes called bronchioles, and finally enters into tiny sacs called alveoli. Your airways and alveoli are pretty springy and stretchy, so when you inhale, each air sac expands like a small balloon, just to contract when you breathe out. The alveoli are surrounded by tiny blood vessels called capillaries. Oxygen from the air we breathe passes into your capillaries, whereas the carbon dioxide from your body passes out of the capillaries into your alveoli so that the lungs can push it out while exhaling. When germs enter your body, your airways trap most of them in the mucus lining of the windpipe, bronchi and bronchioles. These tubes contain hair-like cilia that constantly wipe the mucus and germs out of the airways and body through coughing. And in case any germs manage to pass the mucus and cilia, the immune system gets activated and attacks the germs that enter into your alveoli. But in case of a weak immune system, like in the case of a coronavirus attack, the virus can outnumber the immune cells to enter the bronchioles and alveoli, resulting in its inflammation as the immune system puts extra efforts to fight the spreading virus. This inflammation can cause the alveoli to fill with fluid, making it hard for your body to get the oxygen it needs, leading to pneumonia, which can come in two forms. Yes, a person infected with coronavirus could develop lobar pneumonia, where one lobe of the lung is affected, or this virus could lead to bronchopneumonia, which damages many parts of both the lungs. And once that happens, the person might start to feel some minor symptoms like headache, body ache or fatigue, or major symptoms like chest pain, coughing, difficulty in breathing, fever, and even confusion. Or worse, it might lead to severe complications like respiratory failure, in which the breathing gets so difficult that the person needs an artificial oxygen supply through ventilators. But these symptoms will depend on a lot of factors such as your age, the condition of your immune system, and your current health status. But here is good news, my friends. After intense study and research, scientists around the world have managed to develop a vaccine to fight this virus. Yes, the vaccine contains a part or dead version of the virus, which is injected into the person's body. This is done to expose your body to a weaker version of the virus to stimulate an immune response, so that in few weeks, your body starts producing the antibodies to fight the stronger version of coronavirus. And if you want to know the vaccine process in detail, do check our video, How Do Vaccines Work? The link is in the description below. Also, remember my friends, fighting this virus is the responsibility of each one of us. So make sure to follow the safety methods mentioned in our previous video to stay safe and save the world from this deadly pandemic. Trivia time! Did you know most people who get COVID-19 recover from it? Yes, most people who get COVID-19 have mild or moderate symptoms and can recover thanks to the healthcare staff who are working day and night for us. Hope you learned something important today. Until next time, it's me, Dr. Binocs, zooming out. Oh, don't pull off the mask, little kitty.
Kitty's frustrated.
I totally understand your frustration, and also of those who are forced to adopt this new lifestyle for more than a year now. So, in today's episode, let us explore a hypothetical world where we have to coexist beside these viruses and answer a truly undesirable question. What if COVID-19 never disappears? Zoom in! Coronavirus, we already learned a lot about it in our previous videos, right from the story of its origin to what it can do to your body and the measures we need to take to protect ourselves from this cunning microorganism. So, before exploring today's unusual topic, I'll request you to check out those videos to understand the working mechanism of this virus. But no matter how much we know about this pandemic so far, one thing bothering everyone for sure is that nobody exactly knows how long will it take for the virus to disappear once and for all. Yes, despite all the precautions, vaccinations and medications, we are still unsure about its lifespan and have no idea if it will turn our world upside down or not. No matter what the outcome will be, there are a few factors due to which the virus could stay here longer than expected. And one of the primary reasons is the mutation. Yes, as we know, the virus is evolving rapidly and new variants are popping up in different countries. The more the virus spreads, the more likely it is that a new variant will become capable of escaping current tests, medications, and vaccines. So, to avoid this scenario, it is vital to vaccinate as many people as possible before the virus gets a chance to find the perfect host and the necessary time for mutation that current measures can't detect. Another way corona could continue to spread is the way it originated, and that is through animals. Yes, as we know, there is not just one, but different variants of coronavirus found in animals like the dog, cats, pigs, and cattle that are very common and do not cause illness in people. But the ones originated in wild animals like the bats in China could mutate again and reinfect us. The third way the virus could stay here forever is by not following the safety measures mentioned in our previous video. That's true, my friends. The more we neglect social distancing, wearing a mask and washing our hands, the more time we have to spend with these unwanted creatures. Because of this, we will continue to face the consequences. Yes, because of few irresponsible people, the rest of us must continue wearing masks, maintaining distance, and using sanitizers more than usual. Not only that, happening places such as malls, movie theaters, restaurants, gyms, etc. have to continue to work under strict guidelines, resulting in significant losses for these businesses. And even organizing sporting and music events with large spectators will be next to impossible. And worse, the entire tourism industry could collapse and we will all be forced to stay at home and never get to go to work and school as well. So, The best option to bring our world back to normal is by getting a vaccine shot ASAP. Trivia time! Did you know the COVID-19 disease is also zoonotic? Yes, it means it can spread from animals to humans. And to know more about zoonotic diseases, do check our video on the same topic. Hope you learned something important, so do share this video with your loved ones and do not forget to stay calm and stay safe. Until next time, it's me, Dr. Binocs, zooming out.
That's it! Kitty leaves Earth!
Never mind.
Oh, little kitty, it's been a couple of days now, and your health doesn't seem to improve. I think it's time that we get you a vaccine shot.
Oh no! Vaccines? Scary!
Hey friends, I know, just like little kitty, most of you don't like to get a shot. But vaccines are very essential as they keep you from getting some serious diseases. So, in today's episode, let us learn about this life-saving medicinal boon and answer a pinching question. How does vaccination work? Zoom in! So, what is a vaccine? Well, a vaccine is a fluid that helps your body to become immune to a disease caused by certain germs. But before we go more in depth into this topic, let us go back in time in the year 1796 to witness the story of a great scientist called Edward Jenner, who was known as the father of vaccinology. When he was a practicing physician, he noticed that women who developed cowpox, a skin disease, never developed smallpox. That could be due to the reason that the cowpox and smallpox viruses are from the same family. So he decided to experiment and injected some material from a cowpox virus into an 8-year-old boy called James Phipps, with a hope that this will protect the people against the smallpox epidemic. And fortunately, it worked, as the little boy was immunized against smallpox. And this is how the great vaccination process was born. But how did it work? Before knowing how the vaccines work, we need to learn about our immune system and how it protects us from deadly and not so deadly diseases with the help of an army of billions of cells. When an unwanted germ attacks your body, your immune system gets active and builds antibodies that destroy the culprit. But while they are fighting the evil germs, specialized cells called B cells and T cells are also recording and collecting the germ's information into their memories. As building antibodies takes time, the memorization about the enemies comes handy when the same germ attacks again in the future. Now, the body doesn't have to waste time building the antibodies and quickly takes action to easily defeat the enemies and in the process making you immune against the germy disease forever. But no matter how proficient your natural immune system is, it takes time to learn about the new enemy germs and build the antibodies to fight them. And that amount of time could be enough for the germs to cause enough damage to you that could be fatal. And sometimes the immune system gets weak and cannot fight the unwanted invaders. So what if we prepare ourselves in advance even before the enemy germ attacks you? And this is the method the whole system of vaccination is based on. Using the same natural method your body uses to fight the enemy germs, scientists have developed vaccines to fool your bodies into making memory cells and becoming immune to a disease. Well, one way of doing this is taking a tiny piece of a disease-causing germ or a dead or weaker version of the germ and injecting it into your body. These weak and unharmful versions of germs make sure that it doesn't develop into a full-blown disease. But just like the actual disease, they activate your immune system, which teaches your body to build antibodies to fight against these germs and store their information into the memory cells. And when the nasty and stronger version of these disease-causing germs attacks you, your body is already prepared for it and quickly takes action against them and making you immune against that illness for the rest of your life. Pretty clever stuff, Mr. Edward Jenner. Trivia time! Did you know, in the past 60 years, vaccines helped eradicate smallpox and are close to eradicating polio? Also, not all vaccines are given as shots. Some vaccines are given orally. I understand getting a shot can hurt, but remember that they are your best shot for staying fit, healthy, and wise. Kitty, it's time for your shot.
Never mind.